It's now time for the sponsor perspective portion of our program. I'd like to introduce Mary Smith, board member for Consumers for Quality Care. Take it away, Mary.
Thank you, Steve, and good afternoon, everyone. I'm Mary Smith, a board member for Consumers for Quality Care. We are excited to be celebrating 5 years as a coalition that is committed to giving a voice to Americans in the healthcare debate. We want to shine a light on what people are experiencing as they seek high-quality, affordable care. I would like to thank everyone for joining this afternoon, especially our esteemed panelists and our moderator, Steve Clements. We are here today to focus on closing the gaps in health insurance. More Americans are insured today than ever before. Yet many are still struggling with rising costs, being saddled with medical debt, and facing challenges finding the care they need, especially mental health care. Public opinion research is an important foundation to everything we do. As we bring together policymakers, physicians, and health experts for a discussion about closing those gaps in healthcare, we would like to highlight the findings of CQC's new poll. I'm pleased to be joined by my fellow CQC board member, Jim Manley. Jim is a seasoned veteran of Capitol Hill. He was spokesperson for Senate Majority Leader Harry Reid and Senator Ted Kennedy, and worked on mental health parity and the Affordable Care Act. Jim will discuss some of the research findings with our pollsters, John Anzalone and Neil Newhouse. I will turn it over to Jim to get the discussion started.
Thanks, Mary. And thanks to all of you for joining us today. I'm Jim Manley, and I'm pleased to be here with John Anzalone and Neil Newhouse, two of the nation's top pollsters, two of the best in the business, folks. For the second year in a row, they partnered with CQC to conduct important research into what's on people's minds when it comes to healthcare. Cost has long been a driver in the healthcare debate, as I know from long history on Capitol Hill. Our 2022 CQC poll found that voters are focused squarely on inflation and rising costs as their top concern. What Americans are looking for now more than ever is how to keep money in their pocket, how to get it back into their wallets. That means lowering out-of-pocket healthcare costs and making sure that the care that they do have is the kind of high-quality healthcare that covers everything they need. John Anzalone, as I mentioned earlier, is the founder of Impact Research. John has more than 25 years of experience, including as chief pollster for Joe Biden. He also conducts research for Fortune 500 companies, and like Neil, is one of the leaders in his field. Neil Newhouse is the partner and co-founder of Public Opinion Strategies. Neil has worked in public opinion research for over 35 years. He's been named Pollster of the Year 3 times by the American Association of Political Consultants and has polled for numerous Republican presidential candidates, including for Mitt Romney's in his 2012 presidential campaign. Like John, Neil is sought out after by the business world and appears frequently as a talking head on nightly news programs and in the major newspapers. Thank you both for being here today.
Thanks, Jim. Thanks for having us.
Yeah, it's always fun being here and going through this with you.
Delighted to hear that, folks. Well, let's just get right into it. Okay, so bottom line, what did your research reveal about the voters' biggest healthcare concerns?
Well, we're seeing a lot of the same things that we've seen over the years that Neil and I have worked on together about healthcare costs, right? I mean, when we ask people top of mind, what's the biggest healthcare cost that concerns them? It's always about, things that they got to take out of their pocket. It's the pain point. It's the deductible. So things that, aren't covered by their insurance. They got to go to the doctor, they pay something. They go to, a hospital or emergency room, they pay something. They, out of pocket costs are kind of how they think of it as being nickeled and dimed. They have insurance, but they're not covered. And that bothers them a lot.
Well, speaking of increasing, looking through the polling, the research also shows that medical debt is seriously affecting a majority of the households. Can you expand on some of that polling as well?
Yeah, let me tackle that one first and then turn over to John. This was really interesting, and we haven't really tested this previously, but we asked voters if the medical bills had seriously affected their household incomes, their daily lives, them or someone they knew. 25% of the voters we talked to said it impacted them. 28% said they know someone who had been impacted. 53% total know someone whose household finances have been impacted by this. And the most incredible 2/3 of those say that they know somebody who has had a medical bill go into collections. I mean, more than half of these people say that the amount of a bill that went into collection was at least $2,500.
And when you kind of drill down to vulnerable populations, right? For example, we had a category of people who are just struggling to make ends meet. 80% of those households who are struggling to make ends meet had medical debt, right? And I think 80% or more of Black families. And so again, that number jumps from 53 to 80% in certain universes, which is at that point, it's a pandemic problem.
Well, thanks for that. Okay, again, as was alluded to, mental health. So on the one hand, we've made some pretty significant strides in mental health parity over the years. It hasn't always been easy. It took a while, but we've made a lot of progress. But it's still a major issue, especially now in light of the pandemic in particular. Looking at the research, what does the research say about Americans' ability to access mental health care?
It's a real problem. Again, you said it during the pandemic, we're in our third year. We know that there's a lot of mental health issues that are a byproduct of the pandemic for many, many reasons. And 57% in this poll says that it is difficult to find medical health providers that are affordable and covered by insurance.
I think everyone can agree that reducing healthcare costs, would make a strong part of a plank or strong part of a platform for candidates up for re-election in November. So my question is, what do you think would help move the needle on, the issue of high healthcare costs?
When candidates talk about it, our data indicates that capping insurance deductibles, capping the amount that health insurers can make patients pay for, out-of-pocket costs, requiring PBMs to pass along rebates and discounts to patients. Those kinds of things resonate with voters, and they think that will make a difference in lowering their own healthcare costs.
And I think that one mistake that candidates may make, quite frankly, in this kind of inflationary economic environment is that before inflation was at this levels, we would ask what's the top economic concern, and healthcare would always be the number one issue, right? Because it was a pain point. Now, without a doubt, is gas prices, food prices, et cetera. But that doesn't mean that healthcare costs aren't important, right? When we isolate it, we see how intense and that a majority of people believe that it's a major concern, and they feel that their deductibles and their insurance premiums are going up. So it's an issue. It's maybe overshadowed by gas prices and food prices, and to a growing extent, housing. But it shouldn't be in any way dismissed.
Yeah,
I'm hoping, truthfully, John, that we're no longer going to be campaigning either for or against the Obamacare in this election.
Yeah.
Add my voice
the first one
as well.
For the first time in a decade.
Yeah, well, all very good points. And thanks for clarifying on my last question. So, well, again, John and Neil, thanks so much for conducting the research and sharing your insights. And on behalf of CQC, we appreciate it very much.
Thanks, Jim. Thanks for your work.
Yeah, it's been a pleasure. Thank you.
Thank you.
Thank you, John, Neil, and Jim. To learn more about the research, visit www.consumers4qualitycare.org/research. Thank you again and enjoy the program.